Hi, this is Lee Daly from CARD, and today we're going to talk about supporting individuals on the autism spectrum in emergency shelters. Today we're going to review the core characteristics of ASD and talk about environmental and communication and behavioral strategies that will help people navigate their time in the emergency shelter. We'll also offer some technical assistance. So autism spectrum disorder, or ASD, is a condition that currently affects 1 in 44 children in the USA. ASD is a lifelong condition that affects how an individual communicates, understands, thinks, senses, and behaves. ASD is not a mental illness or a disease. It's actually a difference in the way the brain and nervous system develop. From a day-to-day experience, it can be very difficult to manage the way that the brain and nervous system interact. The differences between individual characteristics is very broad. So one person may need moderate support while the next person might need very, very substantial support throughout their life. Part of ASD is that social communication is different. You might notice that the person doesn't make really strong eye contact when you're talking to them. This is often because eye contact creates some anxiety and it makes it difficult to concentrate on the content of what you're saying. So sometimes they may just focus elsewhere and listen and talk to you. Some people may not use their speech to communicate at all. In fact, they may use sign language or other alternative communication technologies. That would be like an iPad or an electronic device that actually speaks for them. Some may appear to be not listening or showing any interest in conversing with you. And others might have a lot to talk about, but it doesn't necessarily mean that they're going to ask you for your input or your thoughts. Some may have very interesting patterns of speech or particular enunciation, and many will take long pauses between a question posed and giving an answer. Quite often, their processing speeds might be more lengthy. Another part of social communication is that people with autism might be very willing to be honest and to the point with you. They may have the ability to recite scripts or phrases, and they can use these in social situations, but sometimes they don't always apply exactly. People with autism are often able to notice fine details and remember information. Sometimes people may not understand the implied rules or social expectations of every setting. It's important to let them know what the expectations are in your setting. Many people with autism have anxiety. The person may be feeling anxious or desire some reassurance. Do your best to notice when they're anxious and reassure them that they're going to be okay. Often people prefer a use of clear, direct language that means what it says. Sometimes people with autism take things very literally. So do your best to avoid double meanings, sarcasm, metaphors, or idioms like, hey, it's raining cats and dogs out there. Another part of ASD is patterns of behavior. You might notice that somebody with ASD has repetitive rocking movements or hand flapping. Sometimes people might pace, or sometimes they might have other verbal repetitive behaviors. Often people might have particular needs regarding spaces, specific items of comfort and familiarity, and they may require access to personal items to help them feel calm. Some people might have patterns of routines and rituals that are comforting and reassuring to them. Many people have difficulty with waiting, being rushed, or sudden changes to schedules and routines. Unstructured time is difficult to handle. Routine and repetition usually leads to self-regulation. Another part of ASD is restricted interests or fascinations. Some people with ASD may not be aware of other people's needs for space. They may not understand the need for quiet or access to shared items or areas, such as bathrooms. Some people might have topics or items of special interest and fascination that are a source of delight and intrigue. They may prefer to think and talk about these things or immerse themselves in the activity for long periods of time. Some people might wander away to look at or visit items and places of interest without communicating where they're going and without regard to potential dangers involved. They may have a very high interest in water and bodies of water in the area. Some may enter water without the ability to swim or get out safely. Part of ASD could be sensory differences. They may have unusually high or low sensitivity to sound, touch, smell, taste, or sight. They might even have mixed high and low sensitivities between the senses. Sometimes they may have an underwhelming sense of pain, and so that could lead to unnoticed injuries. Some people might avoid unpleasant or painful sensory experiences, and some may seek out experiences without regard to danger or self-harm. A lot of people become overstimulated or overwhelmed with sensory input, and they may display panic, irritability, escalating repetitive behaviors, or get louder with crying and self-protective behaviors. Here are some strategies that help people with ASD feel more at ease and make it easier for them to want to cooperate with you. First, create personal spaces that are clearly defined, either by tape on the floor or some type of string, or using furniture as a visual boundary. These boundaries of space help individuals understand where they are allowed to go and where their personal space ends and another person's begins. Offer personal spaces that are far from exit doors to prevent or deter wandering or elopement. Offer spaces that are away from heavily trafficked areas and as quiet as possible with lighting, carpeting, flooring, and furniture that support their sensory needs. For instance, if possible, opt for spaces that have natural lighting instead of overhead fluorescents. Opt for spaces with low activity or a little bit more quiet. Consider the needs of a family to have members with ASD close to them and under supervision, and try to make space arrangements accordingly. Think about designing a sensory space for periodic use where individuals can get away from the noise and light and smell and crowding to decompress. Avoid using any strong smelling disinfectants or fragrances. Avoid blaring announcements over loudspeakers. Avoid surprising noises or light and power cuts or overcrowding. To help with anxiety, it's important to warn individuals about changes being made to the environment, if at all possible, and if time allows. Use visual cues. People on the autism spectrum tend to be very strong visual learners. For a lot of safety reasons, it's important to clearly identify shelter staff and volunteers with badges, t-shirts, hats, or whatever clear markings can be observed. This will help individuals with ASD avoid listening to and following directions of strangers who might have less than healthy ideas about what that person should do. Post the rules and expectations clearly and consistently in as many spaces as people occupy. Label the rooms and areas and materials that are for public use and indicate which are not to be entered or used. Use arrows and images as well as words to show directions. Communication strategies that work. Use clear and simple statements and instructions. Use visuals to support what you say or write. Stay calm and patient in your demeanor. Your tone can convey a lot of information to a person. Allow an individual time to respond if you're asking questions or making demands. Sometimes processing speeds are a little bit slower. Do not assume that this means that the person is ignorant or unintelligent. Quite often, a person with autism has a high degree of intelligence, but their processing speeds can still take more time. Provide access to electric outlets for electronic communication devices. These devices are the individual's voice. If they don't have a way to repower their batteries, then they won't be able to communicate with us effectively. So make sure you allow some access to the electric outlets. Post a visual schedule and explain or warn ahead of time of any changes. Use a social experience story to explain what's happening and what's going to happen. You might use a communication board if needed to help individuals clarify their information. Here's an example of those two visual supports. A social story on the left-hand side will tell an individual about the situation, about the setting, about what to expect. What are the rules in that situation? What are the dangers and the safety issues in that situation? Who will they be cooperating with? It basically tells them the who, what, when, where, why, and how of settings and situations so they can learn how to manage themselves in those places. Anxiety is a highly common characteristic of autism, and so these social stories actually provide quite a bit of information that help to reduce anxiety and the fears that come with unknowns. On the right-hand side are communication cards. The back side of the card has a keyboard and spaces to show how intense something might be. Common answers to questions that require yes, no, I don't know kinds of answers. And on the other side is a place for you to communicate with them in visual form about specific things that they may need to understand. And if there are any issues with emergency or medical conditions, these might be helpful for you to show them. If you need to have supports made like this for your shelter with more specific information, please get in contact with CARD and we'll help you make those materials. Behavioral supports that work. Understand that individuals will have heightened anxiety and show some empathy for that. Clearly define the expectations for behaviors. What do people usually do when they're in the shelter? Most people don't even know the answer to that. Provide sensory kits, including headphones or earplugs to block out noise, and sunglasses if lighting is harsh. Minimize wait times and avoid rushing as well. Sometimes a timer that shows time passing, like a sand timer or a digital timer, can be useful. Identify and support caregiver break times. Caregivers need to have a constant watch on their child or loved one with autism spectrum disorder to prevent them from elopement or getting into some other safety issues. It's important to know that they also need to take a break from time to time to use the restroom, wash up, or even just have a moment to themselves. See if there's a way to help other family members take on that role or a support staff to cover while they have a break. If an individual with autism starts to show behaviors that escalate into distress or possible safety issues, take cues from the caregiver regarding the family member's behavior. Allow the individual to bring in comfort items and support items. If available, encourage the use of a quiet space in the event of distress or sensory overstimulation. This concludes our brief training. We know you probably have lots of questions and may want to discuss more about autism. Please feel free to contact us at this phone number, 813-974-2532, or if you speak Spanish, call the Spanish line.